CBT stands for cognitive behavioral therapy. And there is an abundance of research showing that CBT is the most effective type of therapy for depression and anxiety. In a nutshell, CBT looks at the relationships between thoughts, behaviors, and emotions, and helps with tools to change the way we feel by changing our actions and the way that we think about a particular situation. So, for example, if I feel really depressed and I'm spending a lot of time in my bed, really isolating and thinking about what a bad person I am, CBT would help by looking at a couple of different areas. It would help by helping you start to identify behaviors that you can implement to start to shift out of that depression. So it might look like I'm going to go for a walk around my block every day. I'm going to call a friend. I'm going to take a shower even if I don't feel like it. And those behaviors would start to help me get out of that depressed state. It would also look at the thought patterns that were also fueling that depression. So if I'm thinking all the time about what a bad person I am, I'm going to feel down in the dumps. But CBT helps with putting that thought to the test by asking two specific questions. Is this thought helpful? And is this thought true? And it has to be both of those things. So you might be able to say, well, I actually am a bad person. That's true. But is it helpful? No. What might be more helpful is thinking, I'm not the best person, I'm not the worst person, but I'm trying as hard as I can. That's both helpful and true, and is much less likely to leave you feeling depressed and sad than if you were thinking to yourself, I'm a bad person. So really, CBT looks at identifying and changing those unhelpful patterns of thought that are keeping you stuck in depression, and also looking at unhelpful behaviors that are keeping you stuck in depression and giving you concrete tools so that you can change those. And by changing your behaviors and thoughts, you ultimately change the way that you feel. Now, I gave this example with depression, but we could give this example with anxiety or with panic disorder or with guilt or shame. CBT has been around for a long time and is the gold standard for depression and anxiety for good reason. It's super effective, and I would be delighted to talk with you to tell you more about how CBT might help you too. If you're curious about how CBT might be able to help you, please schedule a free 15-minute consultation and I'd be happy to walk you through it.